to the Plant-Based Asia Summit, where we inspire a healthier and more sustainable Asia Pacific. I'm Luke, your co-host, and I'm extremely excited to introduce you to Dr. Neal Barnard. Dr. Barnard is an adjunct associate professor of medicine at the George Washington University School of Medicine in Washington, D.C., and president of the Physicians Committee for Responsible Medicine. Welcome, Dr. Barnard, and thank you for joining us today.
Well, thank you for allowing me to be part of this very, very important program. And what I'd like to focus on today is a completely new approach to diabetes. When I say new, I mean it's new to many people. The truth is the research has been going back for quite a number of years to show how this approach can work. And I'd like to share it with you. If you don't mind, I'd like to share my screen. Right, I hope you can see that. Let me start, if I may, by just giving some background about what diabetes is, and then we'll see the role that food plays. And I think you'll be surprised that foods can, in many cases, be more powerful than medications. What we're looking at here is the pancreas. The pancreas is a humble organ right behind your navel, but it has a big job. The pancreas makes insulin. The insulin hormone goes from the pancreas into the bloodstream, and it goes throughout the body, but it focuses on, say, muscle cells, and it arrives at liver cells, and its job is to open up those cells to let glucose come inside. Glucose is a sugar. It's a fuel. It powers your cells. And if you don't have insulin, it can't get inside. So insulin has an important job. Now, let me show you what insulin does. And let me also say that if you're doing something else, if you're texting or talking with someone, let me have your full attention right now, because I want to show you something very important. I want to show you the cause of type 2 diabetes. This purple oval that you see in the middle of your screen, that's a cell. Could be a muscle cell. And muscle cells are powered by glucose. This is a simple sugar that comes from foods that we eat, and it goes inside the cell, and it gives it energy in the same way as gasoline powers your car. Glucose powers your cells. But here's the problem. That glucose builds up outside the cell in the bloodstream. It can't get in. The membrane of the cell won't let it through. It can't get in at all unless you have a key, and that key is insulin. Now, if you're having any trouble seeing these things because there's a photo strip on the right-hand side of your screen, just minimize that or drag it out of the way. That insulin key arrives at the surface of the cell. And when it does, it signals little channels to open up, and they then let glucose come inside. So that's terrific. So the insulin key from the pancreas lets the glucose come into the cell, and the cell has power. What could ever go wrong? Well, what goes wrong is that our dinner looks sort of like that, and our lunch looks kind of like that, and our breakfast looks like that, and we're eating a lot of fatty foods. If you add the fat up, there's a lot of it. So what does that have to do with insulin? The fat from those foods goes into your bloodstream, and it arrives at the cells too, and it builds up inside the cell. These fat particles build up. Now, doctors don't like to use words like fat because it has only 3 letters. So we call it intramyocellular lipid, but that just means fat inside your cells. That fat inside your cells doesn't stop the insulin from attaching, but it stops it from working. The insulin can't do anything. It's attached to the cell, nothing's happening. That cell is what we call insulin resistant. And now the glucose tries to get in, it can't get in, even though the insulin is there. You're insulin resistant, and your doctor says, I'm sorry, your blood sugar is really high. The sugar is not getting into your cells. It's all in your blood. You've got diabetes. Well, what can I do? Well, what if I change my diet so that I'm not eating animal fat at all? In fact, what if I'm keeping all kinds of fat pretty low, so I'm not eating a lot of fried, greasy stuff? That intramyocellular lipid, that fat inside the cell, starts to dissipate. And bit by bit, day by day, as I'm following a healthy, low-fat, plant-based diet, the fat starts to go away. And when the fat is gone from the cell pretty much, the insulin can work again. Instead of being insulin resistant, the cell is now insulin sensitive, and it can allow the glucose to come back into the cell, and everything's great. Is this true? Could this possibly work? Well, look at this. Here's the fat that's in animal products. A lot. Beef, even chicken, fish. We see a fair amount of fat. But look at the plant foods. Very, very low in fat. So I don't necessarily have to cut calories, but if I'm switching from animal products to plant products, there's not much of any kind of fat in the diet. Now, let's walk through the different types. Type 1 diabetes means the pancreas has stopped making insulin. That's due to an autoimmune reaction where the insulin-producing cells are dead. But that doesn't mean that diet won't help. It can still help in many ways because it can reduce the amount of insulin that you need. Type 2 diabetes means the cells are getting insulin attaching, but it's not working. That's what we just saw in our diagram. And then there's another kind called gestational diabetes. When does that occur? It occurs during pregnancy, right? And when a person is no longer pregnant, the diabetes goes away, but it's a sign that type 2 diabetes could be waiting right around the corner. Okay. The current approach to type 2 diabetes at a lot of clinics, unfortunately, is to say, well, I don't know why you can't get the sugar out of your blood, but I guess you'd better just stop eating sugar and don't eat too much carbohydrate in general. So the doctor tells you don't eat too much rice or bread or noodles or things like that. Don't eat too much fruit. And then the doctor also says you need to lose weight, you need to exercise more. So don't eat so much food. And you're going to go to bed hungry every night, but that's what the doctor ordered. And that tends not to work very well. So the doctor at some point will say, this is not working. We need to add medicines. And the doctor adds a medicine called metformin and then adds others. And eventually you might need insulin. Are you happy with this approach? Would you like something better? Well, we can take a lesson from what has happened in Japan. Let's have a look. The traditional Japanese diet is based really on rice. Huge amounts of rice have been eaten for centuries. And diabetes was rather rare in Japan historically. You had the slimmest, longest lived people on the planet. And if you looked at adults over age 40, when diabetes should be common because these people are in their 50s and 60s and 70s, prior to 1980, diabetes was rare, 1 to 5% of the population. But what happened right around 1980, 1990 in Japan? Anybody remember? This is what happened. Fast food chains came in and they said, stop eating rice. Let's have a burger, or let's have cheese. Let's have fried chicken, not just little bits on your rice, but let's have the whole darn thing. And what happened? Fat content of the Japanese diet went way up. Carbohydrate went down as rice was being forgotten. And then by 1990, diabetes was 11 to 12%. What this shows is that getting away from healthy plant-based foods and bringing in the greasy animal products caused diabetes to be much more common. And other things too. People started gaining weight. There was more breast cancer, more menopausal symptoms, all kinds of issues. Even depression became more common. And we believe that some of this had to do with lifestyle changes, including diet. Now, who does better? The Adventist Health Study in the United States did an interesting study. They looked at a large group of people, more than 60,000. These are health-conscious people, mostly teetotalers. They avoided alcohol. They were mostly non-smokers, and they cared about what they ate. However, some of them were meat eaters, and some of them were vegetarians and vegans, and everything in between. So they looked at body mass index. Are you familiar with BMI? It's basically your body weight, but it's adjusted for how tall you are. And a healthy body mass index is below about 25. Some people might say below 23. But in this study, if you looked at the average non-vegetarian, they weren't below 25, they were about 28.8. These are people who ate meat every day. The next group, that's the orange line, these were semi-vegetarians. They ate meat, but less than once a week. They were slightly skinnier, about 27.3, Pesco-vegetarians, what's that? People who eat fish but don't eat any other meat at all, a little slimmer at 26.3. And then lacto-ovo-vegetarians, people who don't eat meat but they have dairy products and eggs. And finally, who's that group over on the right? The vegans. These are not people from the planet Vegas. These are people who don't eat any animal products at all. And they were squarely in the healthy weight group. Now, the reason this was published by the American Diabetes Association was not because of the body mass index, it was because of diabetes. And you saw diabetes, 7.6% of the non-vegetarians, but 2.9% of the vegans. That's pretty impressive. Okay, so we know that a dietary pattern that's plant-based seemed to protect Japan. It seemed to protect people in the United States too. So our research team, with the support of the National Institutes of Health, decided to put it to the test. We brought in a large group of people. They all had type 2 diabetes. Half of them went on a plant-based diet. The other half began a conventional diabetes diet. And the conventional diet was limiting calories, cutting calories to lose weight, keeping carbohydrate fairly steady from day to day, and limiting bad fats. So you're not eating a lot of saturated fat or trans fats, the kind that raise cholesterol. The plant-based diet, no animal products, no chicken, no fish, no dairy, no eggs, but lots of vegetables and fruits and whole grains and beans and all the wonderful foods that come from them. Also, minimizing oil. So sometimes that meant learning a few new cooking techniques to keep the oils low. And I know what you're thinking. Aha, if there's no animal products and I'm minimizing oils, that fat might be coming out of my cells. Okay, stay tuned on that. The third step was we used the glycemic index. Now, don't get confused by this. A high glycemic index food is something like sugar. If I have sugar, my blood sugar is going to rise pretty quickly. However, if I have natural fruit that has the natural sugars in it, my blood sugar doesn't rise so fast. The fruit is lower glycemic index, whereas sugar is high glycemic index. So that was it. The plant-based diet, no animal products, minimize oils, favor the low glycemic index foods. Okay, so to cut to the chase, what we tracked was hemoglobin A1C. And if you have diabetes, you want it below 7 because that's an indicator that your body is handling sugar very well and your blood sugar is never rising really high. The red line here is the people on the conventional diet. They did well. Their A1C dropped by about 0.4 absolute percentage points, and that's very good. The vegan group, though, dropped by 1.2 absolute percentage points, or maybe even a little bit more. That's the blue line here. That was really impressive. Frankly, that changed the world of science because we started to see that diet changes could be more powerful than drugs in some cases. Let me share with you the case of Vance. Vance was a policeman in Washington, D.C., and Vance told me what diabetes meant to him. He volunteered for a research study saying, I've got diabetes all up and down my family tree, and it probably means I'm going to lose a leg, or I'm going to go blind, or my life will be cut short. Vance's father was dead by age 30. Vance was 31 when he was diagnosed with diabetes. But he went on this plant-based diet. And the first thing he said was, this is really easy. I said, what do you mean it's easy? People think of a vegan diet as being challenging. He said, no, no, no. An old-fashioned diabetes diet to him meant cutting calories. So you're hungry all the time. We didn't make him do that. We told him, eat as much as you want. And the old-fashioned diet, they said, well, don't eat too much carbohydrate. So if he felt like having rice or a potato or some bread, they said, no, no, don't overdo it. And we let him eat a high carbohydrate diet if he wanted. He said, you don't make me count anything. I'm never hungry. I had to learn a few new tricks in the kitchen, but this is the easiest diabetes diet ever. And over the course of about a year, he lost 60 pounds. He stopped his diabetes medications. His hemoglobin A1C fell from 9.5 to 5.3, which is totally normal. He changed from being out of control to having such a low A1C that he could go into any clinic in the world and they would not diagnose him as ever having had diabetes. Well, this was remarkable. So let me go a step further and let's look and see the scientific evidence that this approach really is working inside your body. Let's go to Yale University in New Haven, Connecticut. Researchers brought in 26 healthy volunteers, young, thin people. They asked them to do a test. The test is called a glucose tolerance test. What you do is you swallow a little cup of syrup. It's very sugary, 75 grams of sugar, basically. You drink it down, and then the testers will draw a blood sample periodically to watch your blood sugar rise. And many of these people were insulin sensitive. That's normal. That means their blood sugar went up a little bit. It came back down because their insulin was able to move that sugar into their cells. But others were insulin resistant. They could tell that because their blood sugar went up high and it stayed high. It wasn't dropping rapidly. So in other words, the sugar came into their body, but somehow their insulin wasn't able to get the glucose into their cells where it belongs. Okay, so now let's go a step further. Who were these people? Well, they were young, 28, 26 years. They were thin, 60 kilograms, 64 kilograms. These were not overweight people. And their A1C values, they did not have diabetes. They didn't have pre-diabetes. These were totally normal. But now let's go one step further. Let's put them in our MRI machine. We're going to do a test called magnetic resonance spectroscopy, where we can actually look inside your muscle cells. And on the left-hand side of this screen, every dot that you see is a person. And the number that you see is the amount of intramyocellular lipid that we could find on scanning. Now, when I say intramyocellular lipid, you remember that's the fat that's inside your cell. So these are the healthy people. These are the people who are insulin resistant. What does that difference mean? That means the people on the right-hand side of this square had this big buildup of fat inside their cells. And that was why they were insulin resistant. We're going to go a step further. That fat buildup inside their cells affected their cells. Here you see mitochondrial activity. Do you remember your mitochondria from high school biology? That's the tiny organelles inside your cells. They were working pretty well in the healthy people, but not very well in the insulin resistant people. What am I saying? I'm saying these are young people, they're thin people, and they don't have diabetes, but they already have the buildup of fat inside their cells, and it's affecting their cells' ability to work. Their mitochondria aren't working. Their mitochondria can't take fuel and make energy out of it, and they won't have diabetes for another 10 or 15 years, but the process has already begun. The buildup of fat inside the cells from cheese, from chicken, from fish, from beef, from eggs, from greasy things causes insulin resistance, and it causes our cells not to function. So what's the right prescription for type 2 diabetes? Avoid the animal products. If I do that, how much animal fat is in my diet? There isn't any. Minimize oils, and let's favor those low glycemic index foods. That's beans, healthy fruits. Now, we went one step further. We did a study looking at neuropathy. Neuropathy means nerve damage. Many people who have had diabetes for a number of years have the disease process affecting their nerves. And in some ways, it's one of the most miserable parts of this whole disease. You find that you could be numb, so you step on something sharp and you don't even feel it. You could have a cut on your foot that you're not aware of that could get infected. Even worse, sometimes your nerves aren't numb, they're transmitting pain messages to you. So your feet hurt, they ache, or you're having stabbing pains or pins and needles, or you're lying in bed and when the sheet just touches your feet, it causes agonizing pain. We wanted to see if that could change. So we brought in 34 men and women. They were between 18 and 65 years of age. They all had type 2 diabetes. They'd all had it for years, and they all had painful neuropathy. A control group got just vitamin B12. Why would they get that? Because you need it for healthy nerves. The experimental group got B12 too, but they also got a special dietary intervention. And when I say dietary intervention, by now you could tell me, no animal products, minimizing oils, and low glycemic index foods. Very simple. We then, as time went on, asked them, how do you feel? how different is your pain from the start of the study? Was it no change at all, or were you a great deal better? And in the control group, people rated it about a 3. Well, I don't know, I'm a little better. But the control group rated it about a 5. I'm moderately better in a very short period of time, just a few weeks. But then we wanted to do a more objective test. And to do that, we measure something called the galvanic skin response. The nerves in your feet and the nerves in your hands control the perspiration that you have. And using a metal plate, we can actually test your nerve function very quickly, very easily, and totally objectively. And what we showed is in the control group, it was continuing to get worse. That's the tan line. That's what happens with neuropathy. It gets worse and worse and worse. In the vegan group, that's the green line, it started to get better. And there were some people where their neuropathy was, for all intents and purposes, gone. Okay, so plant-based diet is great, not just for diabetes, but for its complications. Now, diabetes has been in the news lately more than ever before, and that's because of the coronavirus. When the coronavirus emerged in China at the very end of 2019 and early 2020, researchers noticed there was a particular pattern where they looked at a large group of people, those who did not have diabetes. There was a risk of dying of COVID-19, but it was nothing like the risk for people who had diabetes. People who had diabetes and they got COVID were much more likely to die of the disease than people who did not have diabetes but got COVID. But it wasn't just a question of whether you had diabetes. It was also a question of, was your diabetes under control or not? If it was under poor control, that's a hemoglobin A1C of 8.1%, the risk of dying of COVID-19 was 11%. But if it was under good control, with an A1C not much lower, about 7.3%, mortality was cut to 1%. Moral of the story, if we can tackle diabetes, we do a whole lot more than just get our blood sugar down. We do a whole lot more than protecting our nerves and protecting our heart. We might be saving our lives. Okay, now there's been an unusual twist on this, and this came much more recently. Diabetes started to appear in people who had COVID-19. They entered the hospital, they were coughing, they were very sick. Nobody thought they had diabetes. It wasn't one of their diagnoses. But as time went on in the hospital, their blood sugars started to rise. It was as if the disease was somehow causing diabetes. Well, there was a meta-analysis done that I want to share with you. It included 4 studies from China, 2 from Italy, and 2 from the United States. And the researchers took the data from all these countries and put them all together. These are people in their late 40s to their mid 60s. And this is what we call a forest plot. And every line that you see is a different study, whether it's from China or Italy or the United States. And you see that big black line that goes vertically from the top to the bottom. That's the 0 line. If all the studies fell on that line, that would mean that diabetes wasn't any more common in these COVID patients than other patients of a similar age. But what you see is all those dots, each dot represents a study. They're all to the right of that line. And what that means is that in every study, you saw a little bit or a lot of increased diabetes risk in people who had COVID. What does that mean? Well, we don't know exactly, but it looks like about 14% of the people in these hospitalized studies would develop diabetes. Here's what we think is happening. It is possible and appears likely that when the virus enters your body, it doesn't just attack your lungs. It appears that it can attack your pancreas too. And so the beta cells of the pancreas that make insulin are attacked. They don't work very well. They're not able to produce as much insulin, so you end up with diabetes. But that's not all. In addition to attacking your ability to make insulin in a pancreas, the virus might attack your liver, where that insulin is going to do its job. The insulin arrives at the liver cells. It's trying to open up to let the glucose inside, but the liver cells don't respond because the virus is there too. That's something we've noticed about viruses. They don't just attack part of your body. They can go throughout your body and affect you in a great many ways. Stay tuned. We'll have a lot more information on this coming up. But for now, it looks like we want to be on the healthiest plant-based diet that we can to avoid diabetes in the first place if we're able to avoid diabetes or get it under the best control that we possibly can, we're stronger against COVID. Okay, so I'm convinced. I want to follow a plant-based diet, but it sounds challenging, doesn't it? How am I going to do this? And what does it really mean? Well, a healthy diet is fruits, grains, vegetables, legumes. Legumes means beans, lentils, and bean products like tofu or soy milk. Also, we're going to take vitamin B12, which you need for healthy nerves and healthy blood. Now, B12 is really important, but you only need a tiny amount, 2.4 micrograms per day. That's very small. And if you look online or go into a pharmacy or a health food store, you'll see bottles of vitamin B12 that are bigger than that. But get the smallest one you can find. Or if it's a really big one, like 1,000 micrograms, you can cut it in half, take it every other day, but you don't want to miss it. Okay, so how do I start this diet? How do I make it easy? How do I make it fun? How do I convince my family to join me? We've broken this into 2 steps, and we've used this method with thousands of people here at the Physicians Committee for Responsible Medicine and in Barnard Medical Center. I've never seen anyone unable to do it. Step 1, take a week. Your job this week is not to start a healthy diet. Your job is just to write down what foods you would eat if you were starting a healthy diet. So let's say you're beginning your diet, or you're thinking about beginning your diet. Take a week and fill out a piece of paper. Breakfast, lunch, dinner, snacks. What would you eat? Well, let's see. Normally I wake up in the morning, let's say here in Washington, D.C., and I have cornflakes with cow's milk. That's not good. Cow's milk is an animal product. It's not vegan, but almond milk would work, or soy milk. Okay, I might have oatmeal porridge and I could add blueberries. I have sausage, but that's not vegan. I could try the veggie sausage. The whole idea here is just to find your list. Everybody has their own favorites. You see what works for you. Move on to lunch, move on to dinner, move on to snacks. Everybody has their own choices, but you take a week, fill out your list. And then after you have a list, and you're going to have a great list after 7 days, now step 2 is to take 3 weeks. And during these 21 days, we're going to go vegan, 100% vegan for 21 days straight. Now that's surprisingly easy because, frankly, you can do anything for 3 weeks. And secondly, you already have your list because you already figured out which foods that you like, and many of them are already on your shelf. And if we do it all the way for 3 weeks, now we're going to see how it actually works for us. At the end of that time, 2 things will have happened. The first is you're going to have some weight loss, your blood sugar's coming down, you're feeling better, your energy's better, your digestion is better. If your family members are eating with you, they're saying, hey, I've lost some weight too. But the second thing is, apart from these physical changes, you'll notice that your attitudes about food change. You don't feel so hooked on cheese or chicken. You kind of forgot about them because you've discovered healthier tastes. And that's a beautiful thing because now you have momentum and power. And if you keep going, the benefits continue to become much more solid and your tastes go toward new foods, new recipes, new websites, new films, all kinds of things that help keep your health journey going in the right direction. So let me stop here, but I just want to say a big thank you. Luke and the team have done such a fantastic job of sharing information with people to help them to change their lives personally, but also to share this information with everybody in their life. They'll never know how many lives they've saved, but I guarantee you it's an enormous number. So thank you for letting me be part of this process.
Wow, amazing stuff, Dr. Barnard. And I really love how you've just synthesized and extrapolated complex science and studies into bite-sized lessons for everyone. Thank you very much. And this is the first time in my life I've actually seen 2 steps to a plant-based lifestyle. That's amazing. I just want to kind of pick your brain here. You mentioned B12, Dr. Barnard. So where B12 is concerned, I understand that. But for vitamin D, what is the recommendation? Because I know many people might be deficient in vitamin D. So what is your recommendation for people who maybe don't spend a lot of time in the sun and want to consider supplementing with it?
Great. Well, you put your finger on exactly the right thing, that sunlight is the normal source, of vitamin D. And so if the sunlight is reaching your skin, it will make the vitamin D that you need. That's nature's source. But nowadays, we often shade ourselves. We might use a sunscreen, or we might stay indoors. Or maybe we live in Canada, where in in the January months, you're not doing a whole lot of sunbathing. Many people will be eager to take a supplement of vitamin D, and doctors would say that's a good idea at about maybe 2,000 international units per day. That number is higher than the recommended dietary allowance that we've used in past years, but many doctors are now saying that vitamin D helps you absorb calcium for strong bones. It might even have an anti-cancer effect. So about 2,000 IUs is a good amount. I would not go higher than that without talking with your doctor.
Perfect, 2,000 IUs. Fantastic. Well, thank you very much, Dr. Barnard, for being part of this summit. I've definitely learned a lot, and no doubt the listeners would have as well.